And thank you, everybody, for joining today. With that, Governor Walz, I'm going to invite you to come on here. The governor just arrived and is available. He's going to give brief remarks, and then we'll stick around for some question and answer here.
Well, thank you, Teddy. Good afternoon to everyone, and thank you for joining us via Teams. I know this is quite different, like much of 2020, but we wanted to make sure that everybody was on and we could have this important discussion with all of you. I'd like to start by thanking the economic team, these incredible servant leaders, public servants, Commissioner Showalter, who came back in and literally took the baton from former Commissioner Franz at a time of, as you're hearing and all are living, great economic uncertainty. I am grateful for him and his team, and I would have to believe that Commissioner Franz is probably listening to us, and so I would like to thank him for that work. As always, to our state economist, Dr. Klombakidis, always gives us great in-depth on the macroeconomics. I think the scholarship that goes into this is incredible. I spend a lot of time with her to understand this. I do think it should be noted, though, bringing the scholarship on a macroeconomic level, but understanding the microeconomics of how this impacts individual families, food on their table and their rent, is a real trait that that Doctor brings to this. I'm grateful for that, Dr. Klombakidis. And Budget Director Rayton, your team has been working nonstop, as you always do. You take the inputs and start to get that data so that we can, again, look at it from a numbers perspective, but how it impacts families. So incredibly grateful. And this is a team that we came into this with AAA bond ratings, with one of the strongest fiscal positions of any state in the nation. The vision of former Governor Dayton and the legislature to build a rainy day fund, to make sure that our fiscal health of the state was solid, went a long ways to making sure that when we needed to provide help, we were able to do so. When we needed to provide testing around a novel coronavirus, we were able to stand that up from scratch in partnering with our public institutions, our private sector partners. And I will have to say, someone told me this morning that they had forgotten that you can get good news in 2020. I'm cautiously optimistic about this. I think we should take that for what it is. I'd also like to make note that the reason that this is good, because of the resiliency of Minnesotans. This is the resiliency of Minnesotans in an unprecedented public health crisis to figure out how to work in a different way, to figure out how to get their kids childcare, to care about their neighbors enough to invest and spend back in their local community, to make sure that those businesses, no matter how tenuous the situation were, knew that they were getting support from their neighbors. And to those businesses who were asked to do things, again, that at least in 100 years, no one has been asked. We've asked Americans to sacrifice, we've asked them to ration, we've asked different things, but on a scale, a national and global scale, and the businesses that were most impacted by this, small family-owned businesses, hospitality businesses, did it. Because what they understood was the health of Minnesotans is directly tied to the health of the economy. So I want to just give a thank you for that. This was never a choice, and never should be a choice, between the health, public health, and the health of Minnesotans and a healthy economy. This false dichotomy that was put out that you had to pick one over the other is simply not correct. That there is a way that we can do this, both from a moral perspective of protecting Minnesotans, but also the long-term health of what our economy looks like and what that provides back to us. So I want to note reasons to be optimistic, reasons to look. Again, some of you heard me say this, especially when it comes to the rainy day fund. Contrary to social media, I have a pretty proven track record of being fairly fiscally conservative. And if you recall, it was last January and February with the calls that we should spend down the reserves. It was too big, and we should give back that money in checks, rather than understanding that that provides the resiliency in the economy that builds the capacity for everyone to thrive in this economy. But that brings me to the next point. COVID has not hit everyone in this economy equally. Some businesses have been able to go on with changes and with changes to routine, but been able to function fairly normally as it was before. Those who were in a position and a privilege to be able to work from home and have the security of that we're able to continue on in a very similar manner. But let's be very clear about this when you look at these numbers. The impact has been disproportionately on wage earners, especially those on the lower end of the socioeconomic scale, communities of color, Native communities, all of those, once again, the most fragile communities, the ones that tend to be precursors of what's going on, they have been hurt, and those small businesses that are the vitality in both large and small communities all across Minnesota. So what I would take away from this is, again, a thank you for the resiliency, the willingness to work to protect health, as well as understanding that protects the long-term value of the economy, but also a willingness to make sure that understanding not all Minnesotans were impacted equally, and it gives us an opportunity. If the federal government's not going to move further, and we're certainly grateful for the work that was done, we're certainly grateful for the CARE Act dollars and some of the emergency powers that allowed us to put things in place to protect folks. Right now, we need them to do it again. Without them doing it, we put out the proposal that we need to move a package. I think what this forecast gives us, it gives us more certainty, which is a hard thing to come by in COVID, but it gives us a certainty, and it also gives us a bridge path to that day on the very near horizon when we start vaccinating folks and we start moving towards that final phase of this COVID pandemic. We can do that now. We should be focusing this on those small businesses most impacted. Again, through no fault of their own, their financial health was impacted to protect the greater good. They made decisions that kept our healthcare workers safe by making decisions about their own hospitality industry. Those are things that we need to, first of all, lift up, but secondly, make sure that we're all in this together. So I'm going to encourage the legislature, and I know they're doing a great job with this, to keep the small business package moving forward. The mechanism that we use and how it ends up, we can come together and reach a compromise on that, but I would just encourage them, and I think Commissioner Showalter's answer on speed and quickness of response in this crisis is really critical. I think that holds true for right now, that we bridge these folks to the new year, we bridge them to the potential for a federal relief package to small businesses, and we bridge this till we start getting folks vaccinated and the threat to our hospitals starts to become reduced. We have that capacity now, and that means taking care of those workers. We need to extend federal unemployment. It's the surest way to get money to folks who are laid off. That's going to expire. Their current unemployment insurance expires shortly after Christmas. We've suggested a 13-week extension of that. That should be the bridge and the time necessary for us to get there. It's a system that's in place. Again, I'm going to give my thanks very unheralded to the folks who manage the unemployment insurance system. Minnesota was, again, singled out as being, if not the most, one of the top two most efficient systems for getting speed and accuracy of our unemployment insurance in an unprecedented volume. So I would say we need to do that. And also, we've proposed a $500 one-time emergency payment to the most struggling of our families. This would be children. And I just want to be clear. The folks that were most impacted by this are children and the families that are trying to support those children. So as we think about the future, I would urge the legislature to keep those fundamental principles in hand about what created our ability to be able to attack this pandemic, be able to create a testing system, be able to get the PPE, be able to do the things we've been able to do. What created the resiliency in this economy? And there's some principles there. One is keeping that rainy day fund and thinking about long-term budgeting and how those services that the state provides are needed at a crisis time. I'm concerned, and we've asked I've asked my commissioners, I've asked our agencies that we needed to tighten belts all the way around. But I'm also concerned that some of the savings we're seeing is people potentially not getting the help they need at a time where they need it. And I think that sets us up as we look forward to the next budgeting. We're right in the heart of the worst part of this pandemic yet, but we have the capacity to take the lessons learned from this and lean forward. And one of the lessons is we're going to, and we have got to get our children back in school. We've got to get our littlest learners back there as quickly as possible. The place where we're at in the pandemic gives me a lot of hope that we are on the verge of being able to do that. And we need to think about the investments Minnesota that made our economy one of the strongest in the country, made it so attractive, was our education system. It's solid, it's good. Quality of life. our state parks, all of those things that we went to. So when we go to the next legislative session, the one thing I hope we're able to do is the smart choices we make build an economy for the future that allows us to not only enjoy the good times, but weather the bad times like we're in right now. So I'm hopeful. I'm hopeful that we're seeing across the state that spirit, that we're in this together. I hope Minnesotans are, again, recognizing that overall, our picture may have improved some. Just like the numbers we give on COVID, they can't just be numbers. There are families and businesses on the brink today. There are more people, 1 in 8 families, wondering where they're going to get their next meal. Children concerned about 1 in 5 children potentially going hungry each night. There's challenges in this, but the good news of the day is we have the resources and the capacity and the fiscal stability and strength to be able to make a real difference in that. And I would encourage the legislature to do that, not just now, but looking into the next budget cycle. And with that, Teddy, I'd be glad to take any questions.
Thank you, Governor. So, folks, let's do what we just did with Commissioner Showalter here. I'd invite folks to raise their hands, and I'll just kind of call through in order here as I see hands pop up. It looks like we've got Tom Hauser first in line here from KSTP. Tom, let's see if we can hear you.
All right, Teddy, do you got me?
I got you. Thanks. Go ahead.
Hello, Governor. The MMB folks and state economists were saying they have factored in the fact that you have a 4-week pause on bars, restaurants, and health clubs right now, but they have not factored in what if that gets extended. A lot of Minnesotans are wondering, now that you're saying Christmas family gatherings might be similar to Thanksgiving, are you likely to extend past December 18th the current economic pause?
Well, no, thank you, Tom, for the question. I think when this got asked yesterday, I know this idea that it feels to people that things are sprung on them shortly. Our hope was, and we took a little detailed dive into the data yesterday, to start talking about data providing us trend data, where we're headed. And I think right now it's certainly no secret that we had, I believe, over 15% positivity today in our numbers. While overall numbers were a little lower, we're still in the middle of this. And so what I'm asking folks is to recognize that the behavior changes we make are going to have an incredible impact on what happens in those hospitals and what happens to the spread. One of the things that we've not been able to quantify, and I say we, this is CDC and everyone is, it is not so much the restrictions that are put in place, it's the compliance and the sense of how serious people think things are. My hope is that we're going to start to see some results of folks making these choices, these good choices, starting to see again that if you do really want to protect the economy, these restrictions and some of the things we're doing on capacity are actually the ways to get there. Because if you make comparisons to states that did not do this, their financial situation isn't any better, and they've got a lot more deaths. So it's always striking that proper balance. And I don't want to play coy with folks. I think it is likely that we are not out of this worst part of this yet over the next few weeks. The game changer in this is we are preparing, and there's the meeting at the White House today on vaccine distribution, what that starts to look like. I got to believe, Tom, and I'm hoping people view it this way, we're coming to the end of this thing. And whether that's in the next few months or not, that will be seen. But this is the time now, it seems to me, that if we could get just a little bit of digging in here, and I would encourage people, you can still help these businesses by ordering takeout. You can still help these businesses in ways, buying gift certificates, whatever it may be. But at this point in time, we'll still wait to see what that data looks like. But I think Minnesotans know this is a challenging time, and we're going to have more data in the next week or so of what happened over Thanksgiving.
Governor, just as a quick follow-up, that was kind of a vague answer, and I realize you're still waiting for more data, but it sure sounds like you're planning on an extension. And there's a lot of people who can't reconcile the fact that Walmarts and Costco's are jammed with people, and health clubs can't have people at 25% capacity, socially distanced, trying to get healthy. I'm sure you're hearing a lot of that yourself, but it also sure sounds like this is going to be extended. Is that the way you are leaning?
Well, I don't pick it as leaning, and yes, I hear some of that, but I also hear from emergency room physicians who are simply overwhelmed. I also hear from nurses and folks who recognize this. And again, I would tell people what we're learning, and it's not an exact science. And I've said the pain that these folks feel, one of the reasons I'm asking and pushing hard, we should be providing relief to those health clubs in this because we're asking them to stay home. Now, again, the layman's objective is that Walmart, the fact of the matter is people spend less time closer together in a larger place with masks on, not breathing as hard. And we keep coming back to this again. The exact science around it is still pretty hard to pin down, but the general overview is the longer you're near someone in a smaller space, and if you're doing things that make you breathe harder, the chance of infections go up. I certainly, again, don't believe that there's a single health club that doesn't want their folks to stay healthy, increase their healthiness. But the fact of the matter is, whether it's here, whether it's in the other 49 states, or whether it's across the world, the data seems to support that these are areas that have higher concentration. And when you're seeing huge amount of community spread right now, the odds are pretty good that someone in that health club, even at 25%, is probably asymptomatic positive. Now, you could say, well, the same thing is true of the Walmart. It's the distancing and the mask. So I would just tell them, I don't lean in any one way. The data doesn't give me an answer and say, here, you absolutely have to do this. We take it and see the direction it's going. I just think I have to be as candid with Minnesotans as possible. Our hospitals are at the highest capacity they've been. Our death rates for the last week was as high as any week in this pandemic, and our case positivity rate is the highest it's been. If that changes, obviously we change with it.
Thank you, Governor.
Thank you, Tom. Up next, we've got Ricardo Lopez with the Minnesota Reformer, who's raising his hand here.
Hi, Governor. Thanks for taking my question. My question has to do with the stadium reserve. The projected increase of 81 million, I think, brings it now to about 230 million, which I believe is more than necessary to pay for debt service. I'm curious if there's any ability to use those dollars for any other purposes. Just potentially even something like housing homeless Minnesotans who are experiencing homelessness.
Well, there is, and I will just be candid on this one, Ricardo. I have suggested that in my budget, but I want to be also very cognizant of the legislature. This is an area that they are not real keen at, some in the legislature of using, and I want to be very candid that I understand where they're coming from on this, that this was a deal that was structured. Obviously, those revenues are up because of some of the behaviors and the tax collections around that. I always think that we should, my mantra is everything should be on the table when we look at it. I will leave it at that. The answer to your question is yes, the potential to be able to use it is there. Do I think that's going to happen? There's some real strong feelings amongst legislatures around this fund. So you have to wait and see, I guess, on that one.
Gotcha. And just a quick follow-up. With the budget surplus projected for this current biennium, do you have a ballpark number for how big you think the state COVID-19 relief package should be, just from your end?
No, not yet. We are working on that. I think you could expect to see that. And I don't want to unduly influence what I think are very healthy and very positive discussions that are going on bipartisan, bicameral wise right now. I do think, though, it gives us more certainty. I certainly think, again, recognizing that there's good news in this, but there's segments of the economy that are really hurting. This gives us an opportunity to really target that. So I don't have the number for you, Ricardo, but I'm thinking some of those early numbers you heard, being batted around probably make more sense now, that we can do a fairly robust package.
Great. Thank you so much.
Thanks, Ricardo. Next in line here, we've got Theo Keith with Fox 9. Go ahead, Theo.
Hi, Governor. You mentioned the hospital capacity and the death rate earlier. I have to ask a question about the morgue, which your administration was installing shelving at yesterday and testing the cold storage equipment. Even though we were told yesterday that funeral homes haven't reached their baseline capacity yet, let alone the surge, and deaths are still far below expectations when the state bought the morgue. So why is the morgue being prepped?
Yeah, well, first of all, from the beginning, as I said, I was not going to leave Minnesotans like we saw, whether it was in Italy, New York, or recently in El Paso, that we were going to have that capacity. Again, this facility was requested by the medical examiners, the morgues, the hospitals. We did receive a request a week or so ago from a hospital, but that wasn't the proper channel. We still had the capacity to cross level with other funeral homes to be able to get that. I think, again, seeing the surge that we have, due diligence has us to, again, be prepared. And again, I knew from the beginning, and this is one that folks keep bringing up, those that haven't really done a lot to help us fight COVID have spent a lot of time complaining about this facility. And I said, I'll own this, that this is the insurance necessary that we don't hit those numbers. I want to make sure, and it's there. We started seeing some of those numbers starting to go up. The capacity numbers I asked about, I think, are probably setting at about 60% or a little more with our medical examiners and facilities. Some of it would depend on if you had these days like 101 days. If you happen to have a big surge, would that capacity overwhelm in the short run? So it's not that there is a imminent use of using this. It's just making sure that it's functional, it's ready to go. And I would note that that this facility more than likely will be paid out of federal funding. Other states did the same thing, preparing. And I'd like to think that preparing for the dignity of our loved ones is worth it.
Thanks, Governor.
Thank you, Theo. Headed over to Esme Murphy with WCCO. Go ahead, Esme.
Okay, can you hear me?
We got you.
Yeah.
Okay. My question for the governor is, a lot of people are going to hear these figures, and for those that have been drastically affected, like those in the hospitality industry or those, who have gyms, are going to want to know, when is the relief package coming? When is the special session coming? Is this going to come before Christmas? Because it really doesn't look like help is coming from the federal government, at least soon.
Yeah, no, and I'm still working them, the federal government, I mean. I still think there's every reasonable opportunity that we get this thing done in the next week or so. We have the numbers now. There's strong agreement that, that we're doing the right thing on protecting our folks, asking folks to curtail some of these activities. There's a responsibility to help try and ease some of their pain. So I'll tell you right now, Esme, I'm very optimistic. Obviously, the package won't look exactly like what I proposed. That's called compromise in a democratic system. But I get no reason, and I'm not getting any, what I feel is pushback around the desire for us to do a package and get it done as quickly as possible. And I think the sooner rather than later. I think the timing, again, that Commissioner Showalter said, and we've seen so often, if we can keep these folks afloat till we get into the better part of the new year and we're moving down a vaccination regime that is starting to spread, and we get some federal help, which I think will come with the new administration potentially, there's every reason to believe that will make a difference. But I'm encouraging folks, let's do this. There's no reason that we can't have this thing wrapped up in the next week or so.
Okay, and quickly a follow-up, what exactly are you proposing? Can you attach some dollar figures to that?
Well, we've said, and I heard the numbers out there when the House Democrats were doing their, kind of back of the napkin response. They were looking at around $300 million in relief packages to small business. Obviously, the unemployment insurance is a little different animal. It gives us more flexibility. That's 13 weeks that would help individuals. We're asking for the $500 for the most needy families. So I think you're looking probably somewhere in that neighborhood. Again, there'll be a package probably come in at 600. There'll be one come in at 100. We'll figure it out. My biggest concern, though, is that this is targeted and timely, and it gets to those businesses who were left out of the PPP, who didn't get. I mean, we were there for the Ford Motors, the large airlines, and that's fine too. But there's a lot of these small businesses, especially in hospitality and others, that we could really get to right away. And it's my vision that we work a system out where they have this grant in their hand in the next few weeks to make a difference this month in their bills, their rent, and their payroll.
Thank you, guys. Thank you, Governor.
Thank you, Esme. Next in line here, we have Patricia Lopez with the Star Tribune editorial board. Patricia, go ahead.
Thank you. Thank you, Governor. I wanted to ask you a little bit more about the funding. So it sounds like the package could be between 300 and 600 million. Is that right? Is that the ballpark?
Yeah, just throwing those out there, Esme. What we did is we took the 14,000 restaurants and venues that were impacted and figured out what it would take to impact them, plus the $500 to the folks that are receiving that have the most needed care, and a few of the other things we were looking at. So probably, I'm guessing, somewhere in that neighborhood.
Okay. And optimally, what is the amount that you would be looking to get from the federal government in the first quarter of 2021?
Well, that's I guess the $980 billion question today, or the $3 trillion. I understand, and I think the package that the House put out back in May was robust, was smart, made a difference. But I've been saying all along, we should just compromise. And what we really need is we needed this help for these small businesses and for individuals. We needed to make sure that we didn't lose eviction moratoriums or the capacity to be able to pay rent. And the states, I want to be candid, states do need some of this, but as you see, we're not in as dire of situation. So I think, at least according to this, I'm more than willing to take a smaller package from the federal government. And if they did that, that would go an awful long ways to being able to make a lot of these folks whole. And again, like I would say, after this is over, we've got work to do. We're going to get these kids back in school as quickly as possible. And it's going to cost some once we do that. And again, I don't know what the school year will look like. Maybe we go through the summer to catch back up. I'm willing to talk to anybody about some of these ways to start thinking about that piece of it when we come out the other end. And that's going to take budgeting certainty. So
okay,
we'll see.
One quick follow-up to that on the issue of unemployment. Is the state dependent on the feds for an enhanced unemployment? Are you looking at an extension or an enhancement? And how actually is that going to get funded?
We would like them to do it, but we are willing to do it. They should do it. The federal government should be doing it. This is a failure, and I'm on record saying it. And if that irritates my Democratic friends in the legislature and my Republican friends in Washington, so be it. They should do it. If they aren't going to do it, the state of Minnesota will do it. And the way it works is we, like every other state, I think 48 or 49 other states, are using federal government funds to backfill their UI until we build back up that surplus. And what you're able to do is they just put it on your tab and you pay it back. My hope would be is if they're going to capitulate and not do the extension and help us out, the least they can do is suspend the interest on those payments, and we'll get it paid back over time.
Thank you.
Thanks, Patricia. One more question here today, Governor. We've got Mary LaHammer with TPT. Mary, go ahead.
Thank you, Governor. Earlier, you said that folks who are most impacted are kids, and you want to get school kids back in the classroom. But the budget numbers showed more than 12,000 students have been lost from the public school system, maybe some to private school, maybe homeschool, maybe delaying kindergarten. But isn't it possible a significant amount of children in Minnesota have just dropped out of school, dropped out of the numbers? And what does this do to exacerbate the achievement gap and the equity concerns we were already facing?
Yeah, I think it is possible. And that's 12,600 out of 870,000. But here's my thing is, the number I really care about is one, each individual kid. And I think you're right. We're losing something. You saw the numbers coming out of St. Paul schools, and I want to thank them for getting data out early. I got one of them sitting right here in my house. I know the grades are going down, and I know this is harder than it should be. So yes, I do think it probably exacerbated, no doubt about it. It did exacerbate the achievement gap, the inequities. That's kind of my point, Mary, that I'd like to kind of set the tone. When we come back next year, all of those things I talked about, I want, again, I certainly didn't envision my time as governor being the COVID governor, if you will. I'm the education governor is how I viewed myself. I want to make a difference in this. I said, judge me by closing that gap. Judge me what happens to our youngest ones. I'm trying to make the case that this gives us an opportunity, and we've convened a group of folks to help us. Let's come back and be creative around education. Let's come back and be creative about education funding. Let's come back and try and figure out where we failed those kids, where COVID dropped them out of the system, and how do we get them back in and make up that difference?
And Governor, if I could follow up, can you make up that difference if kids have really lost a year or even 2 years of school at this point?
Well, the research is hard. The research is hard. All of us know this, especially the youngest ones. I think that's why you're seeing across the country, and us included, there's this scramble to get those little ones back in school as quickly as possible and as safely as possible. This decision about how we're going to do vaccinations, obviously, for the ethical perspective as our healthcare workers and all that, there's experts will doing this. I would weigh in on this, that we need to get teachers, especially those elementary teachers, vaccinated so that we can get all our kids back in school all across the state. If there's a way for us to think about that, I'm asking to do that. But you're right. The research is hard. That's why I think we're going to have to be more creative on what a school year looks like. What have we learned in this? I mean, and there's groups that are doing things that we weren't doing that we should incorporate.
Okay. Thank you, Governor.
Thank you, Mary. Governor, I know you've got to run on to the next thing here. Thank you. I'm going to if you have a closing remarks here, and then I'm going to hand it back to Ellen with MMB.
No, just thank you all for your time.
Thank you, Governor. All right, Team MMB, I'm handing it back to you.
Thank you, Teddy, and thank you, Governor Walz. Commissioner Showalter, if you have any closing comments, now would be the time to share those. If not, we can wrap here.
I think that should take care of it as usual. I just want to remind people that there are materials available on the MMB website. There will be more materials available on Thursday. So those of you who are familiar with the longer document with all the tables and information, that will be available. Obviously, we'll be watching how accurate we are with the monthly revenue updates that also get shown and are published on our department website. So just appreciate all your attention, and more information will continue to be coming from our team. So thank you very much.